Aspirin, or acetylsalicylic acid, is a non-steroidal anti-inflammatory drug, or NSAID, and is generally used as an analgesic for aches and pains and to reduce fever. It has also become increasingly popular as an antiplatelet to prevent heart attacks and strokes in high-risk patients. In its present form, it has been around for over 100 years and is still one of the most widely used medications worldwide. It is estimated that approximately 40,000 metric tons of it is consumed annually. In 1853, scientist Charles Frederick was the first to prepare aspirin by the addition of an acetyl chemical to natural salicylic acid. However, this form was said to be unstable. It's not until 1897 Felix Hoffmann independently made aspirin in a more chemically pure, stable, and palatable form. For several decades, aspirin has been the support of antithrombotic therapy to prevent recurrent arterial thrombotic events. In the body, it has two main functions. It can be used as an antiprostaglandin and as an antiplatelet or blood thinner agent. Consequently, these actions are due to the effect of aspirin on a cyclooxygenase enzyme, or COX. The leading cause of stroke occurs when a blood clot obstructs an artery supplying blood to your brain. Clots that block arteries and prevent flow of blood and oxygen to an organ can lead to infarctions. Clots that block the flow of oxygen to the brain are the primary cause of strokes. However, anti-clotting drugs such as aspirin are able to prevent further clot formation, hence allowing normal blood circulation. The body breaks up the thrombus, thereby restoring blood flow. The aggregation of platelets in concert with the clotting process results in a fibrin clot, which stops bleeding and aids repair of the blood vessel. Aspirin is therefore regarded as one of the most successful non-prescription medicine of all time. Aspirin is also used for the prophylaxis of transient ischemic attack or stroke. It does this by preventing platelet aggregation by irreversibly inhibiting COX-1, thereby preventing the production of thromboxane A2, which is known to be a powerful promoter of platelet aggregation. By doing so, aspirin derives a potential antiplatelet effect. The inhibition lasts for the life of the platelet, which is approximately 8 days. In addition to platelet inhibition, aspirin may also improve reactivity in atherosclerotic blood vessels. Other mechanisms of aspirin in cardiovascular disease may also work. By blocking the formation of COX-dependent vasoconstrictors, aspirin contributes to endothelial dysfunction in atherosclerosis. This may enhance vasodilation, reduce thrombosis, and inhibit progression of atherosclerosis. Furthermore, aspirin reduces the inflammatory response in patients with coronary artery disease by protecting low-density lipoprotein from oxidation. Aspirin can also have negative effects associated with it, with majority of the side effects occurring in the gastrointestinal system and causing major damage. Ulcers in the stomach or duodenum, known as peptic ulcers, are caused by the destruction of the gastric lining of the stomach by stomach acid. These ulcers can subsequently cause patients to experience problems in the gastrointestinal system, such as abdominal pain, nausea, gastritis, and gastrointestinal bleeding. When NSAIDs such as aspirin travel through blood vessels and are released in the stomach lining, it causes the goblet cells to decrease production of mucus and thus allowing the strong stomach acid to come into direct contact with, and in some cases cause direct damage to the lining. Thus irritation and side effects occur as mentioned. To minimize these problems, aspirin should be taken with food or milk in order to provide added protection to the stomach lining. Another alternative is to purchase an enteric-coated aspirin. However, this pill is more expensive and has a slower absorption rate, thus delaying maximum pain relief by approximately 3 to 4 hours. Other side effects of regular aspirin can be seen here. Aspirin can induce anemia and fatigue and possibly allergic reactions. If blood vessels in the brain have a structural weakness, the addition of aspirin may increase the likelihood of cerebral hemorrhage, which may be asymptomatic. Gastrointestinal and hemorrhagic risk factors should be considered when assessing the use of aspirin for cardioprotective effects, so that the best interests of the patient is achieved. Aspirin should be offered to those with a pre-existing heart condition or those at a high risk of heart attack or stroke, but is still uncertain as to whether low-risk patients would benefit from aspirin as a primary intervention. Frequent use of another NSAID with aspirin increases the risk of gastrointestinal bleeding. Accompanying use of an anticoagulant such as warfarin also increases the risk for a hemorrhagic stroke. Helicobacter infections should also be noted and treated with antibiotics prior to aspirin administration. Uncontrolled blood pressure must be reduced to normal in order to decrease the risk of hemorrhagic strokes. Men are twice as likely as women to experience gastrointestinal bleeding from aspirin use. In conclusion, aspirin lowers the chances of having an initial heart attack or stroke by 25%. However, you can't rely on aspirin alone to protect you. There's a lot more you can do, such as maintaining a healthy lifestyle. If you plan to take aspirin every day, take a long walk before you swallow it.